Well, good day, everyone. Welcome to my show. Welcome to Partners in Health and Biz. I'm your host, Gail Dixon-McBride, and I'm so very happy that you can join me today. Well, this is the beginning of June. Can you believe it? Yes, this is June the 2nd. Excuse me, June the 2nd already. And wow, do we have some things to talk about, folks? This is so much. There is so much going on. First of all, in the month of June, it is Men's Health Month. And men, you do not usually take good care of your health. So, in addition to Men's Health Month, it is also Alzheimer's Awareness Month, Cataract Awareness Month, and National Migraine and Headache Awareness Month. But this week we're going to focus on men's health because, on average, men are less likely or less healthy, I should say, and have a shorter life expectancy than women. So, part of the reason is that they do not take care of themselves, ladies, as they don't, as well as they don't take good care of themselves like we do. They are also less likely to have health insurance, more likely to work in dangerous occupations, and often do not seek medical attention when they need it. Men's health issues don't affect only men, they have a significant impact on their family and friends too. The conditions we'll be talking about here can influence everything from sexual and marital relationships to quality and length of life. Unfortunately, most of these issues, especially the ones having to do with sex or masculinity, are very hard, yes, they are, for men to talk about. So, ladies, here's where you come in by encouraging the guys in your life to take even the smallest symptoms seriously and helping them to discuss them with their healthcare providers. You will be helping them take a more active role in their own healthcare. And by educating yourself about potential male health problems and passing that information on to the men you love, you may also be able to save a life. So, what can you do to help? So you need to call your professionals. If you identify a symptom, get your man to the healthcare provider immediately and do not take no for an answer, ladies. But even if he is the picture of health, one of the most important steps you can take is to get him and your boys into the habit of getting regular checkups and age appropriate screenings. Regular checkups can improve their health and help them live a longer life. Now, as with most things, the results of specific exams are important, but not nearly as important as changes over time. In the days and weeks before the visit, help him prepare. Spend some time going over his family history because many diseases have family ties. And keep track of any symptoms you're worried about and write them down. Make a list of questions that he should ask his doctor. Okay, so check him out, ladies. Somewhere along the line, we've got the idea that self exams have to be done by ourselves. Nothing could be further from the truth. There's no reason why your guy can't help you with your breast exams or with his testicular exams. And don't forget about his back. Women get most of their skin cancers in places where they can see them, on their hands and face and below the dress line. But men get most of theirs on their backs, where they are a lot harder to see. So, the one thing that we need to talk about is prostate, the prostate. Men, the prostate is part of the whole male reproductive system. It is a small gland. It is the size of a walnut, and it's located in front of the rectum and under the urinary bladder. It produces semen, which is the milky fluid that carries the sperm out of the body during ejaculation. So the prostate also helps control the bladder, and sexual functions. The urethra, the tube that carries urine out of the body, runs from the bladder through the center of the prostate and lastly to the penis, from which urine is removed from the body. So I know these may be some hard things to talk about, but it's all about prevention, prevention, prevention. The three most effective things you can do for yourself and for your man, for that matter, are to put him on a low fat, listen to me, a low fat, high fiber diet. I'm talking to you as your natural health consultant. I'm Gail Dixon-McBride, natural health consultant. So, ladies, you and your man, help him get regular exercise and get him to quit smoking. Definitely don't want to be smoking. These simple steps can drastically reduce the chances that he will succumb to 4 of the 10 leading causes of death: heart disease, cancer, stroke, and diabetes. Now, prostate cancer is the most common cancer in men, and every year, approximately 250,000 men are diagnosed with this disease, and about 34,000 of them die of it. But if caught early through either a digital rectal exam called DRE, or a specific prostate specific antigen called PSA blood test, this disease is often treatable. New tests are being developed, so when consulting with your healthcare provider, ask if other tests are available. Every man should consider a baseline PSA and DRE at the age 40. He should know his PSA number so that he can compare it with his PSA number at his next checkup. Additionally, African American men with a family history of prostate cancer and men exposed to Agent Orange should consult with their healthcare provider about yearly tests beginning at age 40. And that Agent Orange was something that happened to men when they were in Vietnam and other areas. So, men and ladies, what are the symptoms of the early stages of prostate cancer? You ask me. Well, it usually shows no symptoms. However, as the disease develops, so do the red flags. Men should notify a healthcare provider immediately if they notice any of the following: hip or back pain, difficulty urinating, painful or burning urination, blood in the urine, and there are some treatment options, but those are the symptoms. The treatment options for prostate cancer generally include, but not always, removal of the prostate, which is a prostatectomy, radiation, hormone therapy, immunotherapy, or cryosurgery. Men with localized low risk prostate cancer might choose active surveillance and closely monitoring the cancer to see if it progresses or becomes aggressive to determine if treatment is needed. So don't wait to the last minute. Don't wait when you start having symptoms, men. You want to go to your doctor, or even before you have symptoms is the best. Because sometimes when you have symptoms, your prostate problems have already progressed. So you want to get your annual checkups. Make sure this is very, very important. I can't tell you how many men I know who have died of prostate cancer. And I mean, it's treatable and it can be caught and you can be helped. So, what are your options? The options and the possible side effects of treatment could be discussed with a urologist or other specialist. Your loved one might consider getting a second opinion. It's always good to get a second opinion before proceeding with any of the available options. Now, ladies, these are things that you should know about prostate cancer. Prostate cancer strikes 1 in 8 men. 1 in 8 men. The risk factors include race, with African American men having the highest rate of prostate cancer. Family history is involved, age, and exposure to certain toxic chemicals, like I mentioned earlier, Agent Orange. A diagnosis of prostate cancer can be a life and relationship changing experience for many men. So, men react to news and deal with difficult situations much differently than women. We know that, ladies. So, the news of being diagnosed with prostate cancer and having prostate surgery can result in various relationship and intimacy challenges. Things between you and he may change. He may find there to be depression, psychological stress, anxiety issues with intimacy, or shame from being able to perform or having erectile dysfunction, which is ED. But luckily, there are many ways to help deal with it. If the prostate treatment he chooses has caused erectile issues, there are many techniques that he can try to improve intimacy. There are treatments available such as oral medications, penile injections, vacuum erection devices, or penile implants. Consulting or sex therapy is also another option where the therapist may suggest additional creative ways you two can recover the sexual intimacy, such as incorporating different uh, things into your life, such as sex toys. It will take time, but you will find something that works for you too. Your loved one should begin by talking to his healthcare provider about treatment options. So BPH or benign prostate hyperplasia. Is the man in your life making frequent trips to the bathroom during the night, ladies? Is he enjoying social activities less because he always has to be near a bathroom? Has he complained about weak urine flow or difficulty in starting urination? These are all questions that you should be asking your partner, asking yourself as you talk to him. If your partner is over the age of 50, these symptoms may indicate that he has a non cancerous enlargement of the prostate known as benign prostate hyperplasia, BPH. Now, although BPH is easily treated, many men are unaware that treatment is available. So, ladies, when your partner, your husband, your brother, your father, your uncle complains of urinary difficulty, such as even your son, such as frequent urination, incomplete emptying of the bladder, a weak urine stream, or difficulty starting urination, or if you notice changes in urinary patterns, encourage him to make an appointment with his healthcare provider. Medications are available, which in some cases could begin to relieve the uncomfortable symptoms of prostate enlargement within 4 to 8 hours. The good news is that in general, BPH does not cause erectile dysfunction and does not diminish your partner's sex drive. The reality may also be that the uncomfortable and embarrassing symptoms of an enlarged prostate may not put your partner in a romantic mood. Having the sudden urge to urinate can be a distraction. When BHP or BPH, I should say, symptoms affect your partner's lifestyle, the quality of your life, ladies, also may be affected. So, what fun is it to go to a movie if he feels embarrassed by the need to find a bathroom a couple of times during the show? Why go on a leisurely ride through the countryside if you both get annoyed by the constant need to be on the lookout for a rest stop? Why have friends over if a lack of sleep caused by repeated nighttime trips to the bathroom makes him grumpy, or if Concern about his urinary problems makes it difficult for him to concentrate on the conversation. BPH does not need to cause disruption in your partner's quality of life or affect your lifestyle. The symptoms of an enlarged prostate can usually be treated quickly and effectively with medications and other treatments that are not medical, but that reduce the pressure of the prostate on the urinary system. Once that pressure is reduced, BPH symptoms may improve. So that's why you should encourage your partner, your brother, your husband, your son, your uncle to see a physician. Things every woman should know about BPH. First of all, an enlarged prostate is the most common prostate health problem among men, usually affecting men over 50. BPH is a condition associated with aging, probably due to hormonal changes. By about 50, about half of all men have begun to develop an enlarged prostate. For men over 50, prostate enlargement is likely to continue through the rest of their lives, but not always. BPH symptoms occur when the enlarged prostate presses against the urethra, the tube that carries the urine away from the bladder. As the prostate slowly continues to enlarge, symptoms may gradually worsen, interfering with sleep, physical comfort, and routine activities. BPH symptoms vary with the individual. Not everybody suffers the same way. Some men with BPH experience an urgent need to urinate, while others may have difficult starting. In most men, BPH symptoms can be effectively managed with medication. If left untreated, BPH may eventually curtail or slow down a man's activity and interfere with his lifestyle and could lead to more serious medical complications requiring surgery. BPH is a non cancerous condition. Non cancerous. There is no known link between BPH and prostate cancer. Now, there is something called prostatitis or prostatitis. Prostatitis is an inflammation of the prostate that may be caused by an infection. It is the most common problem among men under the age of 50. And about 50% of all adult men will be treated for it during their lifetime. Research is being conducted to determine if a history of prostatitis is a risk factor for prostate cancer. And there are three major types of prostatitis or prostatis: bacteria prostatitis, non-bacteria prostatitis, and prostatinia. Symptoms of prostatitis are similar to those of BPH and prostate cancer, but they're not. It's not the same. So your symptoms for prostatitis is occasional discomfort in the testicles, urethra, lower abdomen, and back. Discharge from the urethra, especially during the first bowel movement of the day. Blood or urine in ejaculate. Low sperm count, sexual difficulties, fever, aching muscles, chills, fatigue, and frequent or painful urination. Men with symptoms of prostatitis should see a doctor to prevent symptoms from turning into serious complications. So that concludes this segment of Partners in Health and Biz. I certainly hope you, men and ladies, have enjoyed this information or have been taking notes. And if not, this is a podcast and a video. You can always go back and revisit the information that I've shared. So, if you are someone who has a background in health and wellness, I would love to talk to you, interview you on the Partners in Health and Biz podcast or video. You can email me partnersinhealthandbiz@gmail.com, partnersinhealthandbiz@gmail.com. And visit the website, my website, for more information www.partnersinhealth.biz. Partnersinhealth.biz. So until next Saturday or Sunday, I'm your host, Gail Dixon-McBride, natural health consultant. Stay healthy and business savvy. Have a blessed day, everyone. Ta ta for now. It's been my pleasure to be here with you today and to